Welcome. Wounds Canada is known for caring for the wounded. I'd like to welcome you all to COVID-19 pandemic, caring for the carers. And this is session 3. This is our last session. Are you excited? Woo! Okay, well I am. So our Wounds Canada team is still here. I'm Heather Orsted and Jackie Hickey is here as well. And Elena is also here with administration. Now you notice I took away the wound picture because let's face it, we all know why we're here. But unfortunately, we're here for another reason as well this time. I feel quite comfortable in representing Wounds Canada in saying, now I'm upset, in saying that our thoughts and prayers are with you in Nova Scotia and all Canadians as we grieve this terrible tragedy that happened to us over the weekend. So we're thinking of you and we're supporting you. So I said, here we are. We've done session 1. We've identified the problems. Session 2, we've discussed the problems. And now we're here in session 3 to identify or develop or hear your strategies and resources as we move forward to live with the reality of this COVID-19. We're also today going to spend the bulk of the time with you, talking with you, listening to you in an open forum. So we've done the heavy lifting. We've asked the questions. We've got to the heart of the matter. So like I said, we're here for the strategies. You also have to remember, as we leave today, you've got these strategies in your mind, but who do you need to help you? I couldn't do what I'm doing on my own. Just ask any of the people in this panel. We've worked together to make this work. So who do you need to make it work in your environment? And remember, this is an unpredictable and unprecedented reality, this COVID-19. So you always have to look back, is it working? Is what's happening, what's supposed to be happening? So review, review, review. So today our format, we're going to get an update from Dr. Ranjani Somayaji on COVID-19. We were going to get lived experience from Martin Hales, but he just contacted us that he got pulled into an emergency meeting. We're going to have a brief review of the resources, and we have them posted online. Looks like I started to write it there, but I do have it in another spot, so don't worry. The main thing is we want to hear your voice. We want to acknowledge that you have some great strategies, and if you have questions, that as well. And then finally, we're going to have thoughts from the panel. Housekeeping, for those of you that are just joining us, we want you to give us feedback and participate. This will be recorded on the Wounds Canada website, and Olena says she'll have it up tomorrow, all 3 of them. So, you know, go if this is your first one, go back to 1 and 2. To make it effective, keep your phone or computer on audio, or audio on mute. Raise your hands to share your voice, or if you're not comfortable doing that, you can type the question into the screen. And we've got Jackie there who's going to look at the questions and give feedback to us, and Olena's going to track the raised hands. So participate, participate, participate. Now we've been playing with this model all week, and as you can see, I've filled in a little bit because we've got a lot of resources, but we've got a lot of blanks. So what Jackie and I are going to do tomorrow is go back over some of the great feedback you've given us, update this, and get it online. Right, Olena? Yep, perfect. So we welcome back Janet from Nova Scotia, Noha George from Toronto GTA, and Dr. Ranjani Somayaji, who is, we're very happy to have all 3 of you back. And welcome to Martin, who never made it today. So Martin was going to share his experiences, but maybe somebody else can do that. So we're going to start with Ranjani. If you can give us an update on what's new in COVID. So tell us when it's going to be over.
Thank you, Heather, for that wonderful introduction. I think we addressed when it was going to be over and return back to normal in the last webinar, so we won't do that again today. I mean, thank you again for having me, and it's great to be here. You know, I think we are still in the thick of things in many locations, and I think there's lots of new things happening, and so really, to put it briefly, I think overarchingly, now we've exceeded 2.5 million cases of COVID in the world. Looking at Canada, there's just under 39,000 confirmed cases and about 1,872 deaths. So when you calculate that out, that equates to about 4% death rate. As scary as that sounds, and sort of putting it into context, influenza has a mortality rate overall, like not basing it on age groups, of a 0.1%, so that's about 40-fold higher risk death rate. But the big caveat for all of you is that we're only finding what we test, right? And so remember that a large number of populations aren't tested, and so that death rate is probably elevated more so than the reality, and so it's probably going to be less than that. So if we actually tested the entirety of the population, many people probably have been exposed and remain asymptomatic or have mild symptoms. And then depending on the province you live in, kind of more testing for people with symptoms has only rolled out in the last couple of weeks, so we're testing more now than we were before. So that's just something to keep in mind. There's lots of studies going on into, you know, how easily is it transmitted, who transmits it. So places like Iceland have tested a large population, or a large amount of their population, where they found that up to 50% of people with COVID have no symptoms or have mild symptoms eventually. So that is the reason for all of this masking and stuff like that has come in. Serology testing, so basically where they take a bit of your blood to say, have you been exposed? Do you have antibodies to it? A number of test kits are being rolled out and tested across Canada. So once those are validated, that probably will come into place, at least for healthcare providers, if not more public. And then we'll have to kind of think about, does reinfection happen? Is that possible? And so I think we don't have that information yet fully. So that's to be decided and to be learned. And then vaccines, I think, are the other thing that we're waiting on. And when we think about vaccines, you know, on average before, it takes 2 to 4 years to develop a vaccine probably, and really more in the likelihood of 4 years. So when we're thinking 1 to 2 years, it's actually speedy. And there's a vaccine, there's obviously a number of companies looking at vaccines, and I think one of them in the UK is going to be starting to enroll humans already. So and hopefully it works. That'll be the key, and that's the reason it's important for multiple companies to still work on the development. So hopefully we so I think really it's about keeping on and keep on doing what we're doing, and hopefully we get some answers and we're all safe soon.
Thank you so much. Thank you so much.
Oh, good evening, everyone. My name's Janet. I'm a professor. I teach at Cape Breton University, and I work as a clinical nurse specialist in wound care. And as many of you know, the trauma that has been put upon people in Nova Scotia has been daunting at best. And we have appreciated your prayers and care. And as you know, 2 nurses were fatally involved. And so it's been very interesting to watch the communities come alongside each other. Lots of discussion around prayer, and yet through COVID, people have responded and been very creative in their way to offer condolences and prayer and support for the many families involved. And so I think I marvel hour by hour with the creativity and the kindness of people reaching out. I think that's what I would probably best say, Heather.
Thank you, Janet. Thank you. I know we were, all of us were concerned because we know you, we know Kathy. Kathy Burrows is also in Nova Scotia. You just don't know. This hit a little bit closer to home than we're certainly used to. We'll address lived experience when we get into the open forum. So if any of you have experienced COVID personally through your family, think about that, and maybe we'll touch on that in a few minutes. Now, Ranjani and Valerie, who works with her, pulled this together for us. Now, I'm just going to briefly go over a few of these things. We'll get to all your questions in a few minutes, okay? We have a lot of resources available for you that are going to go online after this session today. So you'll be able to go on any of these and click. Now, I'm going to try because on Friday, I opened this one up and was so impressed. And let's see if I can get it. And now let me know if I'm sharing here. Share screen. I'm getting pretty good at this. Let's see. There we go. Can you see it? Yay, I did good. So this is under COVID, under Nova Scotia, and there's all sorts of things you can get into, mental health and alerts and notices. Every single one has something like this, so it's pretty darn impressive what we've been able to pull together here for you. Now let's see if I can get back to my other screen. That's always the trick, right? Let's see. Am I there? Yay. So you've got a lot of resources here, Johns Hopkins, public health, and every province. And I know, Elena, you put the territories up there as well. So we have that for you, for all of you. The next one we have that is available. Now you know this, but it's easy access. So you can go on and click on, and I'm not going to click on them, but most of them here have a COVID front page. So you can go on there if you're a nurse, if you're a foot care nurse, if you're a chiropodist, you can go on here and find out what your professional body is doing to support you. I also put the BC CDC on here because it didn't fit on the other page, but that's one that Dr. Bonnie Henry mentioned the other day, and I've not seen that one before. So, and I'm not sure if the other provinces have it, but there you go. Healthcare resources. Now this MD Connected is, well, I think it's entirely an Ontario-based program, but holy macaroni Batman, it covered pretty well every town I could find in Ontario, major center, and OHIP covers the doctor's visits. And also telehealth and telemedicine. So you heard Janet, I believe, earlier say, you know, if there's 1-800 numbers, copy those down into your phone or click on these lines and they'll take you right in there. I also found Canadian Virtual Hospice. I went online there. It was very interesting, very informative. It had a lot of different subcategories for lay caregivers, professional caregivers, soup to nuts. And then as Noha was mentioning the other day, talking about the financial resources and the EAP program, again, lots of pieces in there that you can access. And then Trudeau's the government's economic response plan is also in there. And you open that up, and again, English, French versions, lots of information. And then finally, mental health and counseling. And again, Jackie helped with a lot of this. As I mentioned, Ranjani, and of course, Janet and Noha found this information. So we've got the Crisis Service Canada, Ending Violence Canada, Kids Help Phones. And again, you know, get these numbers on your kids' phones or wherever. The counseling services, WellCan, I know Janet said that this is one that Janet and Noha came up with, and it's a counseling service available, I believe, across Canada. Noha, can you correct me?
Yes, it is.
Across Canada. And then the focus on the family has more of a spiritual bend to it, so, you know, it's got something for everybody, literally, body, mind, and spirit. So these resources are there, and they are completely available for you. And like I said, Elena and Addie are uploading this, and you'll be able to access this on the front page of Wounds Canada. And there's the link right there, actually. Is that correct, Elena? So if they click on that link, what will that do?
That'll take them directly to the resource page, and all of those links that you highlighted are in one spot, and then they can click away.
So the previous pages, they can't click on those links, but this one they can click on.
They can't, they'll have all the access to the links within your PowerPoint that are live on our website.
Okay. Good.
Heather, it's Janet. I just want to remind everybody, it's part of our responsibilities to know about the resources, but methodically, proactively go through and choose a few that you think might be of support and preload them onto your phone or your device, is what Heather was emphasizing.
Yeah, and they're not all, it says professional, but they had for your patients, for your caregivers. So, really get into it, dig into them, open them up and find out what's valuable in there and what you can use in practice, in daily practice to help make it easier. I mean, many minds, right? It takes a village, quoting Clinton, it takes a village. So now I want to open the forum up, and Ranjani, would you like to describe the forum? Yeah, that's you, Ranjani.
Sorry, what would you like me to describe?
Describe what we want them to do during.
Sure. I mean, I think, Heather, you already said it. I think really we want all of you to speak up about your experience and bring up questions. I mean, I think we are trying to do, our goal is to do our best to give everyone something, at least one thing that they can take away from this. And so we may not be able to address your individual situations and questions. And chances are, if you ask a question, many other people feel that way. But I think it would probably be most helpful if you have questions or concerns or opinions or experiences, if you can also speak about the group that you work in or the setting that you work in, so that way others can relate to that.
Good point. What I'd like to ask first, does anybody, and put your hand up because Alana can see it there, has anybody here experienced COVID-19 themselves or a family member? We never did ask that question in session one. It might be interesting to hear from you since Martin is in a busy meeting. Anybody, Olena?
No one so far, no.
Ranjani, you were mentioning to me earlier about the false negatives, and you were saying sometimes the test isn't being done accurately. Do you want to address that, the false negatives?
Sure. I mean, in general, so the testing is a swab, either of your nasopharynx or your throat. And I mean, all of the tests, there's no gold standard, and it's really the gold standard would be to culture the virus, and which is hard to do. But in essence, the test for the majority of it is probably sensitivity in the range of 60 to 70%, which means that there is going to be false negatives. So people get tests, have symptoms of COVID, they get, especially mild, they get tested and they could be negative, and it doesn't necessarily mean that they don't have COVID. But essentially, I mean, the discussion was all about, why aren't we testing enough? And really the summary was that we are, I think testing is increased, and testing is based on supply as well. And as much as Canada's not testing enough, we're testing way more than many countries. Alberta's one of the highest testers. We can certainly improve, but if you have limited supply, you're going to want to save it for people who are the sickest. It makes sense to test someone and make sure they're positive if there's available treatments for everyone that are good and evidence-based. But if there's no treatment and your treatment is sit at home and give yourself TLC, it makes less sense to test everyone with mild symptoms when you have a limited supply.
Yeah.
But again, the goal would be to get enough supplies and find new tests and develop new tests that we can test everyone, or at least do serology testing on everyone to determine who needs a vaccine, who's been exposed, etc. And that is being trialed in certain countries. So I think there's been some news in Germany, for example, where they're testing people, and if you've already had COVID infection, then you might get a certificate or something else. I mean, that can be a long philosophical discussion in itself, but the whole point is to try to, how do you open up society in a safe way?
Yeah. You know, Calgary is one of the sunniest provinces in Canada, and
It
you're
is.
experiencing it right now.
Heather, we do have someone who would like to speak. We have Rhonda.
Hi. So I'm in private practice and I've tried to identify some best practices moving forward. But I'm just wondering, has there been anything identified as best practice for seeing patients in the future?
For seeing, I'm just going to clarify this, for seeing patients with COVID?
No, just being able to reopen my clinic, period. You know, like being able to, like the kinds of things that I'm considering are, there's 2 practitioners in the clinic. So booking patients with longer periods. So an hour for each patient rather than a half-hour appointment. And staggering the appointment times. So I bring one client in and the next person in the next half hour brings a client in. So there's not that overlap of people being next to one another.
In our previous webinars, I'm not sure if it was 1 or 2, but we did have some comments with regards to exactly what you're saying, Rhonda, is, you know, do we pre-screen people? Are we having them wait in their car? Are we making bookings longer so that when people are coming in, they're not having to congregate in the waiting room, that they're waiting in their car and then they're called in based on appointment and things like that? I can't remember who had made that suggestion, but they were very active in the changes that they had made within their clinic. So if that individual is on the call, if they could comment, that would be great, because I think this is really what we're trying to do, is building a strategy here.
Yeah. So a lot of those comments actually came from me because
Well, professional body, Rhonda.
I'm an RPN and I have a nursing foot care clinic.
Yeah, so I talked to Pat McDonald. I'm sure you know who Pat is. She's the past president of your organization, and she said she's been receiving a lot of questions and to keep them coming, and they're addressing them as quickly as they can. But she's your professional body. I'm not sure who the new president is. She's the past one, but you know, I've worked with her. Miriam Botros, who's on the call right now, she's worked with her. So I think that's your best avenue, is to go through your professional body. Are you in Ontario?
Yes.
Because RNAO also addresses LPNs, do they not?
Yes.
Yeah, so either of those bodies. Irma Jean was going to be on the call, but she looked at our last session and said, by golly, you guys are, you know, you got it. Do you really need me? And I really wanted this time, or we wanted this time to be for you, the people who are on the call. But, you know, RNAO would be another good place to go. So go to your registering bodies, because they're the ones, you know, if you ever get sued, they're the ones that will back you up, right?
And I think just to add to Heather's suggestions, I think it's also like your local hospital or health service that you're involved or affiliated with, that would also be sort of the best. So for, you know, anyone working in Calgary, for example, Alberta Health sends out regular communications. These are essential services, these are not. So it would really come down to whether, I mean, in general across Canada, like essential services and people who need to be seen urgently are the ones that can be seen in clinic. So for example, in infectious disease, we have a home IV antibiotic clinic. And so even with those, half of them we don't see. And then we see the ones that absolutely need to be seen for IV antibiotics in person. So it really comes down to what is an essential service. And otherwise they would expect that you would develop or have virtual visits with everyone. And they actually have certain technologies that are considered secure as well through the health services that you're part of. And so they can help set that up in your clinic so that you can continue to have a clinic, albeit virtual, and then only see the urgent patients if that's deemed allowed for you in your specific clinic.
So Ranjani, let me give you a hypothetical here. Let's say Rhonda is caring for person with diabetes that is at high risk for infected nails?
I have 4 people in my clinic right now that have diabetic foot wound ulcers. So I see them, like, I continue to see them in the clinic. You know, I provide them with gloves. They wash their hands in when they come into the office. I said gloves, I meant a mask. We're wearing masks in the clinics, myself and another person. So it's, I'm more looking at moving forward, like when this is kind of done, you know, or it's not going to be done. We all know that it's not going to be done. But what are some of the best practices we need to put in place moving forward? So, and I hear everything you said, so thank you. I will.
Yeah, absolutely. And I think you're doing all the right things, Rhonda. And I mean, continuous PPE and all of those things. And so that'll be the easy part. So really, I think I would suggest that you just kind of, even tomorrow, just initiate a conversation or send an email to, you know, your provincial health, or like your clinic, whoever is in charge of your managing people, depending on the structure of where you work exactly, and start from there and say, okay, well, who are the patients that I can see in clinic and how do I do that? So
I know,
like the provincial health services should also have exactly a layout for it. So I mean, in the Calgary wound clinic, they are still seeing some urgent patients, and we're doing all of that stuff that you said in terms of personal protective equipment. There are some patients that, you know, need to be seen still in person but can't make it to the clinic for whatever reason, and so there are a couple of physicians as well as other providers that are going to the home to do a home visit as well. So it isn't that you can't see anybody, but you just want to also make sure that you're practicing safely.
And like I said, I'm not concerned about today. It's like a month from now.
Yeah.
PTP, things take time.
Yeah, and these practices and these policies are actually being updated and very dynamic, and so probably get a new one every few days, which is why it's confusing. So, but I think that's what I would suggest. And even some of the provincial resources that we've provided, probably even start there and then go to the other higher up managers.
Panelists, we also have Tracy who would like to speak.
Okay, Tracy, welcome. Ranjani, you're looking more and more like God as that sun glares down on your head.
I've chosen the right position then.
Okay, where's our next person?
Go ahead, Tracy.
Tracy, you're on.
Thank you, everybody, and thanks to the panel tonight again for hosting this. I've been able to tune into all 3 sessions, and I think this is fabulous to take all of our issues and bring back answers, basically. One thing that I have not addressed, and I just wanted to throw it out to find out if anybody had any information based on their province or any experience at where we stand with any kind of contact surveillance. So what are we doing in each province to track COVID? And of course, this will be valued information in order for us to try to become a society again. So I was just curious if anybody has had any experience or any resources moving forward to look at for province.
Tracy, can you specify what you mean by contact COVID?
So in my particular province in Ontario, RNAO has been very active at asking any kind of nurse that is able to do virtual support through COVID, and I'm being one of them, that they've reached out to actually go out and do telephone surveying to determine more about contact surveillance. So part of it being to understand perhaps patients that are currently struggling with it, people that they've been in contact with to help understand the spread or stopping the spread, potential testing. I'm taking a big guess at it because I haven't been involved in it yet. I wish I had and I could share with everybody, but it's kind of in that regards.
So is that like if I have COVID-19, you're going to come and ask me who I've been in contact with, and then you check all the people I've been in contact with? Is that what you're meaning?
This is not just in Canada. This is worldwide, right? Any country that's been affected by COVID are trying to study the disease. So we go and use some different terms in different countries, but I believe in our country it's called contact surveillance. So we're trying to find out more information. And because I haven't been a part of it yet, I'm waiting to help volunteer in Ontario as a registered nurse to support this role through public health units here in Ontario. But I was just curious if anybody else had experience, and what is it we're surveilling, and what is it our ultimate goal? What are we looking for?
Well, let's open that up. Has anybody on the call done any of this kind of work? Because I don't know if any of us on the panel, I know I haven't. And Jenny,
No.
what to do with it?
Yeah, I'll let others comment first.
Okay. Are there any calls? Olena, anybody?
There's no one who's raised their hand yet.
Jackie?
No, nobody with regards to that specifically.
Well, let's Ranjani, maybe you talk on it then. Sorry, dear.
Sure. Oh, no, that's okay. So contact surveillance or contact tracing. And so, I mean, it generally comes down to a public health mandate, at least in Canada. And so even the provincial websites, as well as PHAC, so the Public Health Agency of Canada, has more information regarding that. And the general thing at this time, again, based on the numbers, is that we contract trace, or the public health team contract traces people that are actual cases, and then asks about their exposures. The people under investigation, so suspected COVID or people who have tested negative but have symptoms, are not contact traced just because of the capacity needed. At least in several of the major centers, medical students have volunteered with public health teams because they're off school for the most part anyways. And so that's been a helpful thing. I think if you're interested in volunteering, you can do that through PHAC. They're looking for people as well as individual public health agencies. I mean, the goal again is to get a better sense of what is the prevalence and incidence in our population.
Right.
And then it also helps us determine things like community transmission, asymptomatic transmission, because of testing and treating. And then we can actually mandate or develop or modify existing public health policies based on how we're doing in all of those regards.
Okay. Thanks.
Thanks, Dr. Reggie.
I would like to hear if anybody has some strategies they'd like to share with us. Remember, we had the 4 different components. We had clinical practice, professional, personal, and family. Are there any strategies that anybody has to help them move forward with COVID?
Heather, we just had a suggestion with regards to your local public health units to utilize them. And as well, clarification with regards to foot care. It is best to approach your provincial guidelines and follow your provincial guidelines.
Yeah, yeah. Okay, any other questions or strategies? Come on, don't be shy. You're still on, Tracy. You can give us some strategies. Hi, Tracy. Do you have any strategies that you're using currently?
You know, I thank you again for the opportunity. I really, ever since the kind of breakout here in Canada, the first week of March, it was really, I think for myself, I mean, all of us being in healthcare, and I'm no longer direct patient care at the bedside, but do have a role in health clinics and hospitals across Canada. And I think for me, it was really to be educated and keep up with the information, not the media, the true facts, and be that provider to neighbors, friends, family. And, you know, even my 22-year-old, I'm so proud of him, who's an apprenticeshiping to be a plumber, told his owner and his workers, I'm not coming into work because this is not safe. And hence the business has shut down after the essential work factor came in. But I just think that we all have a part to play. And for me, it was educating myself so I can help others. And now that I am permanently at home is to find a routine in my day. So every day I need to have a routine, and it really has helped to keep me, it's been difficult, but to stay in contact, doing webinars with folks like yourself and panels, keeping in close contact. I do a lot of webinars with RNAO And I think it's fabulous. It always helps me. I get off and I feel connected again and strong, ready to go for the next day. So that's just my personal.
So a routine and keeping connected.
Mm-hmm.
And it sounds like you're connecting professionally and personally and of course your family. Does your son live at home?
No, he's on his own, and he really wanted to come visit Mom last week. And I said, babe, as much as I'd love to have you, not the right time yet. So, but he's not seeing his friends. And I think for young people, it's very difficult too.
Mm-hmm.
They're used to sports and they're working out at the gym, and he's not able to do any of that. So, you know, it's difficult for everybody.
Yeah. Well, thank you for sharing that, Tracy. Now let's see if somebody else is just as brave.
We do have Suzanne who would like to speak.
Okay, welcome, Suzanne.
Hello.
Hi.
Hi. Yeah, I just wanted to share some of my strategies. So I've got a son, so I have taught him proper hand washing techniques. We've gone on daily walks or hikes away from people. It's quite where we go and where I am.
Okay.
We practice social distancing
Yeah.
really well, and he's been really good at it too. Ran around the garden to keep fit as well, because that's totally private and away from people. He's 10.
Okay.
And what else I've done? Yeah, I've been sharing hand washing techniques from educational valid sources online to the public through my Google My Business, through my Facebook page, and shared it to the public on other groups and things just to help people do proper hand washing, and fed back that everyone should be abiding to everything, doing social distancing, because if people don't, it's going to be around longer, this virus. I follow WHO daily, World Health Organization, because that's where all the governments are getting first-hand information from. So it's better that we all tune into that anyway, see what's happening around the world. I'm from England, so I'm keeping in touch with what's going on in my own country back there with Nice. And they're like the Ministry of Health and monitoring everywhere, making sure people are working up to standard and things like that. And I was really pointing out that the
organization and relief funding for our
Leanne, I think Leanne has popped on here. There we go. Watch your mute buttons. It creates chaos for us. Carry on, Suzanne.
Oh, sorry. Yeah, there's no. Yeah, nobody should not be wearing PPE. It should absolutely be provided. There's nurses dying every day now in England, and it's making a lot of us angry, because I was already saying, if you can't have proper PPE, then you shouldn't be going to work. And now they've actually come out with all that, and they've actually made that official through the governing body, the nursing board, and the best union in the UK, RCN, that states that nobody has to go to work if they haven't got adequate PPE, because A, you're going to catch it, you're putting yourself at risk, and we have to look after ourselves well before we can protect others. We know that from training. That's very important. That's number one, I think. And two, if we don't do that, we're going to be spreading it to other people. So it's not going to help. So they've made that a rule now.
That's perfect, Suzanne. For some reason, I get all the UK news on my computer, and I don't know why, but yes, I'm seeing all the deaths of nurses and doctors as well.
It makes me angry, because that shouldn't be happening.
It's heartbreaking. I had my husband read one of them today because I couldn't even read it anymore.
Yeah.
Okay, let's see if we've got another caller.
Heather, I've got some comments with regards to the PPEs and just what Suzanne had said as well. I'm not sure if Janet maybe can, just make some comments with regards to the ethical dilemma that some people are feeling that they're in.
Oh, thank you. I went to mention about the PPE and help you all how to find it. So I've seen how really hard it is to find. I mean, CPC, who is one of my suppliers, and Pedicare in BC, they haven't had masks easily. I went shopping around the local pharmacies. Forget shoppers and places like that because they never have anything. But the local smaller pharmacies, I've had a lot of luck. And one of them, he orders it in. He always gets masks. And they're CE approved, so they're safety checked. They're medical, I made sure. And plus, it's coming through the pharmacy, so you're more likely to trust that anyway. They know I'm a foot nurse and I'm doing essentials. So I've had no problem getting my boxes of masks and hand gels. And because I know it's so hard, I make sure I'm getting them in, I'm getting 2 or 3 of them at least, and 3 boxes to make sure that I'm not going to run out. Because if I run out, I know I can't go to work.
Okay, Suzanne, let's let somebody else answer some questions. We're going to run out of time here, and I see we've got quite a few people backed up. But thank you for your comments, and I think we all share your concern about the PPEs for sure. Thank you so much. Jackie, do you have another question?
Just a suggestion from Sheila again is to stay educated and stay connected. Supporting each other and being there for each other, I think is a very positive strategy that people can utilize.
Okay, good. Any hands up, Elena?
No hands up at this time, but please feel free to do so.
Okay. Janet, do you have any comments on what you've heard?
Hi, Heather. No, I just want to hear more from people like Suzanne has shared. What other strategies are they doing to stay well?
Yeah. This isolation, we talked about it before, the increased stress from being isolated. Maybe not yourself because you're knee deep in alligators, but with your family, extended family, grandparents, parents, children. Any strategies people have had? I know we've had social distancing picnics with our grandchildren where they are, we get the fast food and they're far across the lawn, we're far across the lawn, and we shout back and forth on what's new in our lives, what we're doing. You still need to see people. The hard part is you can't touch them, you can't get close, you can't hug them. These are big issues. A big issue is going to hit Nova Scotia as well with all these, I hate to bring up funerals, but I mean, that's going to be a big issue there, the grieving for all these loved ones right across Canada, never mind just in Nova Scotia. Anyone else?
And we did have a comment with regards to that, Heather. Someone had made a suggestion or commented that they believe that they will be allowing 5 people to attend funerals. And I know in Ontario, it's been very difficult. We have a very close neighbor that has had a loss. And it's very difficult because they couldn't go to the hospital and the spouse was left behind in the retirement home. And so they're torn between mom, who's very ill, and dad, who's been left behind. So, again, strategies that would allow that connection and that ability. I've had some interaction with personal support workers that are using their personal cell phones and calling the family members on behalf of the elderly clients and their loved ones so that they can see them and speak with them.
That's the one I had my husband read today. A nurse was dying, a 50-year-old nurse, and the nurse that was caring for her held the cell phone so her daughter could say goodbye to her, and they were praying together on the phone, or the daughter was praying, and the mother passed away while she was praying. I mean, that whatever contact you can get for people, and now with digital phones, I mean, you can bring people's faces to loved ones. Are any of you experiencing that? No comments?
Heather, can I make a comment on
No, huh?
just what I'm observing? there's no doubt that the group that we have here is a very, for the most part, very well-adjusted, hardworking group of professionals who are used to being in worker bee mode. One of the interesting things that I'm noting is, and of course I can't label this because it's up to each and every individual to be aware of where they're at, but I couldn't help but think about the question about preparing, you know, for best practices, etc. And for me as a psychotherapist, I'm sitting back and I'm thinking, this is a wonderful time to just take a rest, because I know that for all of you, you work so hard. And I've already noted that there's a very special trait about wound care nurses that I've worked in the healthcare field for 25 years, but it takes a very special person to go in there and to get right to the core of that woundedness. And I'm sure you're doing it on many levels, but I just want to remind people how important it is to do the check-in with yourself and to ask yourself and to give yourself that permission. First, ask yourself, where is this coming from? Is there some anticipatory anxiety? Do I feel a sense, do I feel that I need to control everything right now? Is this something I need to let go of for the moment? Do I need more rest? Because I'm sure that the hard work is yet to come. And we don't realize, of course, the best practices I'm sure will be presenting themselves, but perhaps this is a good time to sit back and do some good self-care and practice some awareness and get in touch with your body and how you're feeling, and you know, perhaps not feel that necessity to go into the worker bee mode, but rather just to sit back and observe and to notice yourself. So I don't want to sound like I'm on a soapbox, because each and every person copes differently. And clearly as a collective and as a country and as a world, as a planet, we're all grieving together. But the sense that I'm getting is that a lot of the nurses on this webinar are definitely at the acceptance stage, and they're moving forward really quickly, and they're going beyond that. And I can't help but think, just try to slow down a bit. Please take a breath, notice your breath, notice yourself, take that time to do that self-care.
Well, Jenny put it well the other day when she said, I take a day off of social media. And I took Sunday off. But then when I turned the news on Sunday night, I had a heck of a shock. Yeah. So, yeah, but I liked what you said, Ranjani, when you said, I turn it all off.
Yes.
I think,
yeah. Example. Yeah.
I think, I mean, yeah, I think it's great to hear everyone sharing. And I think it's important even as the panel members to say, what are we doing to cope with this? And I mean, I think, for example, I think of it as hashtag pandemic life goals. So my goal is to develop at least one new life skill in this time frame.
Like haircutting.
If I actually, yeah, haircutting is my first one. But if I master it, or at least I don't end up being like one of those hair disasters that is being posted everywhere, then I will think of a second skill set. We tend to, like, I tend to eat pretty well, and so now I have more chips, because I'm like, guys, if I got COVID tomorrow, I might as well have some more chips today. We do, like, I do conditioning workouts with my sister over FaceTime, and she designs the workouts, so just as another way to, like, work out in your home or exercise so that somebody's keeping track of you. Yeah. And then I try to make sure that I have pants on for all of my Zoom meetings when I work at home. Because there are people that don't have pants on, so. So, I mean, I think it's important to find, I think, you know, like lots of things happen. Life is full of hardships and hurdles in one way or another. And I think it's important to find the humor and the smiles and the resilience, because I think that when we face the hardest things is when we actually realize how resilient we are. So.
Yeah, the strength that we have. Very good point. Okay, last question before we move on. Any other questions there, Jackie or
yeah, a couple of comments. Heather, work-life balance has been mentioned. Pictures, sending pictures, communicating with family members while they're at work, so that they can stay connected with their loved one, which is great. And thank you to Noah for your comments. And Suzanne also mentioned, you know, connecting with her parents as well. on a daily basis just to check in. And sometimes, just a suggestion when we're checking in on our parents, if we open it up, how are you doing? Obviously, we're going to get, I'm fine. So, maybe have a couple of questions that you can pull out of your back pocket just to make sure that they really are fine. And if you have the ability to do the visual, that will definitely help as well.
Yeah, open-ended questions, for sure, open-ended questions. Okay, I'm going to ask each of you, except not Martin, because he's not here. Janet, some final thoughts.
I wish I could have heard from more people. I wish our call was longer, Heather. But I liked what Ranjani said. I'm fairly methodical in that I get dressed, get up, get dressed every day, get ready to go. And safety truly is at my forefront all day. My husband is immunocompromised, and so I think I have this heightened vigilance about bugs on a good day. But I've limited myself to 3 minutes of TV.
3 minutes?
Yeah, I can't do longer than that.
3 minutes?
Yes.
That's not even a commercial.
Yeah.
Janet, I need to introduce you to the trash that I watch.
Okay. Noha.
Let's listen to our bodies and not forget that our bodies hold a lot of wisdom. It's often through our breath and our bodies that we experience or that we express whatever we're going through. And let's dignify that reality and what we're experiencing instead of denying it and work through it. And I'm going to second what Dr. Ranjani said about resilience. I'm a firm believer that it's in the moments when we suffer the most that we grow the most and we find the most meaning. And I think one of the biggest sort of myths that we've all been told, particularly in the Western world, is that the purpose of life is to constantly feel a sense of enjoyment. But in my personal world, the goal of life is to find purpose and meaning. So I'm often asking the question, what can I learn through this? And how can I become more fully human and more fully alive? So just watching what has been happening in the world since this pandemic has been really heartening. It's been incredible to watch the humanity in us and to see once again that, taking care of each other has sort of become the focus and the primary goal of every human being. And that's the kind of world we want to live in. So my hope is that we don't forget these core values that we're all embracing as we go through this difficult time, because this will end, this pandemic will end, and we'll get on with life. I hope that we can remember the lessons that we've learned through all of this, the many beautiful ones. So
thank you, Noha.
You're welcome.
Ranjani.
Okay, I think there's been a lot of great things said already, and I agree with all of them about this too shall pass. I think, the one other thing I would add is that there's lots of things that happen in the world and they continue to happen. So it's important to be aware that although we are inundated with all COVID every day and every night, the same things that were occurring and going on in the world before COVID are probably still happening, and maybe to a larger degree. And we often base what we think is going on in the world based on the news feeds that we subscribe to, but those news feeds are just being inundated with COVID news. And so I think there's still a lot of other things. And so similarly, our lives still exist, and we still exist, and we still have our needs and wants and stuff. And so it's about finding a creative way perhaps to address them. And I fully agree with Noha that about enjoyment and joy. I think joy and happiness are fleeting moments. And I think it's about seeking contentment in addition to purpose and meaning. And that way it's actually a lasting thing. And we have an opportunity here to say, okay, let's reassess our lives and how do we attain the things that we really want.
Yeah, for sure. Okay, so we've been talking about this the whole time. You're not alone. You're not alone. We're out there. We're all out there. And Noha said it. We're a community. We're a strong community, a caring community. So your takeaways are take time take that time to reflect on the issues and concerns, but don't go cray-cray on it, okay? Don't go cray-cray. Reach out and discuss them with others and plan strategies, together. What was back in 1990, I think I wrote things I learned from wounds, I say work together. Bugs know it. Bugs know it. Why don't we? Work together. What you think, what you feel, and what you do matters. So a real thank you to our experts and to all of you who came on. You can still talk to us, okay? Olena will gather any lasting thoughts or concerns. So please, fill that info at Wounds Canada. Next steps, we want you to send us suggestions for future webinars. Again, get on info at Wounds Canada. You are going to get a survey monkey tomorrow. And that's not a real monkey, it's a survey monkey. It's your evaluation. Please send it back to us. What you believe to be important about this webinar is important to us. We want to get better and better. A clinical survey is going to be coming out that Janet's been working on with Wounds Canada. So if you're connected to us at all, you'll be seeing this in the next little while. And then get back on Wounds Canada, use it as a resource. The At Home for Wounds had 2,500 downloads in 1 week. And we've got Venus coming out next week and Pressure the week after that. Complications for diabetic foot ulcers. These are all at home and designed for lay people. The BPRs, nonstop, the BPRs. We've got a brand new one coming out in May on arterial ulcers. We've had over 500,000 downloads. And these aren't looky-loos, these are downloads. So we'll have a total of 10 of these available. So, talking about best practice recommendations and what you can do that's best practice, go online. They're all free, downloadable. And then the last little box that you see over here, this is a brand new UCP program, unregulated care providers, because those are the people, the docs that are going into the hospitals in Ontario right now in long-term care are having to feed and bathe and change because there's not enough UCPs, there's not enough caregivers, PSWs, UCPs. We need people in long-term care right now. So this is a training program to help people become more confident and competent in those areas. So there's lots of next steps for you to take. Parting words, well, I don't know if you all have seen Dr. Bonnie Henry. She's sort of the pride of British Columbia. And she wrote this book. Janet told me that she recommends this to all of her students. Soap and Water and Common Sense, the definitive guide to viruses, bacteria, parasites, and diseases. And up in the corner, it says how to fight coronavirus, pandemics, flus, and deadly diseases. So, yeah. So she's been our little star here. And that's her farewell every night. Be kind, be calm, and be safe. The last picture I'm going to leave you with is courtesy of Jackie's daughter, who made this beautiful heart for us. And I wish you all be kind, be calm, be safe. Thank you. Thank you for being here. Thank you.
Thank you.